Assalamualaikum everyone, welcome back to this channel. This is me Alia Waheed, and in this video we are going to start about the all the disorders which are related to the thyroid gland or thyroid hormones. So thyroid glands, there are some types of disability or disorders happen in it, and these disorders are happens. Now we will discuss that what kind of drugs are going to treat them. So first of all, we will discuss a short anatomy of thyroid gland, at what it is, and after that we will discuss our topic. So thyroid gland is a ductless endocrine largest gland which is present in the body. Where it is located mean what is the location? So it is present in the front portion of the neck, located around the trachea. Weight of it is about 25 to 30 grams. Shape is roughly butterfly shape, and it has two lobes on either side of trachea, as you can see in the picture. So this is the thyroid gland, which is which is present on the trachea. Now let's discuss what are the thyroid hormones. So this thyroid gland is responsible for the releasing of two types of hormones, which are T4 and T3. T4 is also called as thyroxine and tetraiodothyronine. Okay, so these are the three names they can call you. What is thyroxine? They can call ask you that what is that tetraiodothyroxine in the Viva, so you should know about it. So actually this T4 goes to your liver or your kidney and convert itself into active form, which is the T3. So actually T3 is the active form and T4 is the inactivated form of it, which convert itself. But there are some responsibilities of T4, like it is it is responsible for the formation of RNA and the formation of protein synthesis. So now let's discuss about T3, which is the triiodothyronine, which is the activated form. So let's discuss about their functions. So their function is to increase the growth, to increase the metabolism, to develop your body parts, to increase the appetite, to increase the digestion process inside your body. It also increase the breathing rate, heart rate, and also produce more and more heat in your body. So in the winter season, especially because of the low temperature outside, your body inside heat is maintained at the 37 temperature. So therefore thyroxine is more released in order to balance the body temperature. So therefore in winters you feel your body warm due to the secretions of thyroid hormones. Now after discussing this, now we are going to start at how these two hormones T4 and T3 they are released from that thyroid gland, and also we will discuss that what kind of diseases happens in their disorders. So here I have given that how the thyroid hormones are released. So you know very well there the hypothalamus is present. Now the hypothalamus is going and releasing a TRH. What is TRH? This is the thyroid tropin releasing hormone. What is it? Is thyrotropin releasing hormone. Okay. Now this releasing hormone will activate the anterior pituitary gland, and it will allow the anterior pituitary gland to release another hormone, which is what? TSH. And what is THS? It is thyroid stimulating hormone. So it is going to stimulate your thyroid gland and to produce the T4 and T3 hormones. So how the production of T3 and T4 happens? So now the mechanism of their synthesis is going to start. So first we will discuss their release, how they are released. Now we will discuss how they are produced. So actually what happened, this is your thyroid gland one cell, okay. Now what is happened, due to the anterior gland, it will activate the cyclic AMP pathway, and due to the activation of this cyclic AMP pathway, the concentration of iodine I negative increases, around your this gland, particularly in the surrounding of it, and due to the increase in the concentration of iodide, and it will enter into your thyroid cell. Like this iodide is now entering into this cell. Okay, after the entering into the cell, the various kind of enzymes are already present in your thyroid gland. They will act upon this iodide ion and convert itself. Now, first of all, the enzyme peroxidase will act on this iodide ion and convert it into the I2, which is the iodine. Now again the iodination happens. Iodination means to add the iodine. Now another atom of iodine will add it in itself and make it I3. Now this I3 will happens the condensation happens, and the two hormones produce T3 and T4. How they are produced? Actually, the condensation happens between the two dihydrothyroxine. When the two dihydrothyroxine combine, T4 will produce. And if the monoiodothyroxine and the diiodothyroxine combines, they will lead to the formation of T3. After their formation, they will move out of the cell, thyroid cell, and they will directly release into the blood. And in the blood, various kind of binding proteins are present. So albumin protein is the most important protein which binds to most of the drugs. But in case of thyroid hormones, there is a special binding protein which is called as thyroxine binding globulin. This protein bind itself with the thyroid hormone, and they will help in the transport of these thyroid hormones to the particular location, and will allow them to perform their specific function, and to make your body in a balanced way. But the bond formed between this hormone and the protein is irreversible. It can be reversed back when it reaches to a particular cell where it has to perform its action. But in our body, there is a negative feedback mechanism which is already present in it. Like T3 will send signals to your anterior pituitary gland and causing the inhibition of it. By inhibiting it, now TSH will not produce and T3 will not produce. So it is also inhibiting it itself. But the negative feedback response is very little, because most of the thyroid hormone already binded to the protein. Like let's suppose that 80% of the thyroid hormone is binded. Only the 20% will go back and to perform the negative feedback. Similarly, it will also bind to your hypothalamus, giving the negative signal, causing the decrease in the production of TRH, and inhibiting its own production. Similarly, T4 is increasing their production. Okay, so they are increasing their production, but T3 is decreasing their production with the negative feedback. So now, how the mechanism of action, I have explained it in the diagram. Now let's discuss their pathology. So two types of pathology will happens: hypothyroidism and hyperthyroidism. Hypo word being to decrease. Being it is a state in which you have the low production of T3 and T4 hormones. So when you have hypothyroidism, what kind of symptoms you will observe in your body? So actually your growth of the body will decreases out, the metabolism will disturb. The metabolism means the food items, like in your food, carbohydrate, protein, lipid, they are present. And the thyroid, these thyroid glands are responsible for the increasing the metabolism of them. But now if the thyroid gland is not releasing them properly, then your digestion, your metabolism cannot happen. If your digestion cannot happen, you will gain the weight, because now there is no one who can metabolize your carbohydrate, who can metabolize your lipid, who can metabolize your protein. So therefore you will gain your weight. As a result, your breathing rate will decreases out, your heart rate decrease, and you will feel cold intolerance. What is mean by cold intolerance? It is mean that you cannot bear the cold. Means some people who have this type of way, that they are very sensitive to the cold. In winter season, they cannot bear the winter. So this is due to the hypothyroidism, because of less release of T3 and T4 hormones. Now we will discuss that what kind of diseases can happen due to it, and what kind of drugs we should give to a particular patient. So here I have written what are the causes of hypothyroidism. So these are the two causes. First is the goiter and can also be called as iodine deficiency. And second is Hashimoto's thyroiditis. What is first discuss this Hashimoto's thyroiditis? It is an autoimmune disorder in which your body own immune system destroying your thyroid gland. Now in this way you are destroying your own self. So this due to this disease happens to you. So in this disease what we going to happen, first thing is that you should clearly cut off your thyroid gland by the use of surgery, but we can also use some kind of drugs to treat it at the first. Let's discuss about the goiter. So goiter, why the goiter happens due to the deficiency of iodine. So why? Let's discuss their mechanism. Actually, your pituitary gland send TSH to your thyroid gland, but now your thyroid gland is having no iodine. So therefore, you know why iodine is important for the thyroid gland, because due to this iodine, your T3 and T4 is produced. Now, if you are not taking the iodine, your T3 and T4 will never produce, and if they are not produced, you will cause the swelling of your thyroid gland, and due to this swelling, the goiter will happens to you. Now, what is the treatment of the goiter? Simple, you will use the iodine salt. So therefore we will call the patient to eat iodide salt, but not in very large amount, because if he takes in very high dose, then it will cause other severe diseases like hyperthyroidism. So it should be used in a limit. Then we will discuss the specific drugs which are used for the hypothyroidism. So mainly three drugs are used for it. First is the levothyroxine. It contains only T4 hormone. Second is lithothyroxine. This it contains only T3. So levo is containing T4, litho is containing T3. And there's another third drug which is lithotrix. It is a combination of both of these hormones, but the only T4 means levothyroxine is a drug which is mostly used. Why it is mostly used? Actually, it is well tolerated, mean it has very low side effects, and second, it has very long half life. So the drug which have very long half life and acting for a long time period, it is more beneficial for the patient. So therefore we will benefit to use levothyroxine. And you know that T4 is a unstable hormone, or you can say is an inactivated form of it. So when this T4 goes to your liver or goes to your kidney, it will convert itself into the activated form which is T3. So therefore we can give T4 to the patient, and it will also help in the formation of RNA in them and in the formation of protein synthesis in them. So we can give them, and it is mostly used in most of the patients. Now toxicity happens. Let's suppose this patient has taken more than one doses of the levothyroxine on daily basis. What will happen? The level of T4 inside your body will increases, his heart rate increase, tachycardia will happens to him, his weight is going to lose down. Why lose? Because T4 is increased. Now the digestion will increase, and when more the digestion happens, you will lose your weight. The fat which is present in your body will going to decrease due to the high metabolism, and you will also feel some kind of nervousness, palpitations, mean having the sweating over all the body. So these kind of side effects will happen. And it also has the drug interaction like phenolphthalein, phenobarbital, and rifampicin. These are the drugs which can induce the enzyme which is the P450, and then they will increase the metabolism. So therefore they can interact with the hypothyroidism drugs and causing the side effects. Now we have discussed all the drugs which are used in the hypothyroidism. Now we will discuss the opposite condition of it, which is the hyperthyroidism, in which the levels of T3 and T4 is very high. So let's discuss it. So here I have written the hyperthyroidism in which the T4 and T3 is increased. Now let's discuss their symptoms. So in this symptoms, now the levels of T3 is very high. Now there will be the very very high metabolism in your body. Very high heart rate means from the normal level it increase so much that the heart rate will go so much high. The breathing rate is very high. Normal breathing rate, 25 to 30 minutes per seconds. And digestion will increase so much that the patient loses his weight, and the heat intolerance will happen. So now the patient cannot bear the heat, because that T4 and T3 are responsible for the production of heat inside your body. Now if their level increase so much, then they will cause more and more heat production in you, and because of more heat production the patient cannot bear the summer season. Now let's discuss their causes. So they are causing the Graves disease. This is also a autoimmune disease in which the own antibody of your body. And what is this antibody? This is the TSI, thyroid stimulating immunoglobulin. This antibody will act same as the TSH is acting. It is stimulating the thyroid gland and causing more and more production of T3 and T4. So due to this, the grave disease, the person, the people who have Graves disease, their eye are so much of bigger size that we cannot see them. Due to this, the Graves disease happens to them. Now how we will give treatment to them? So the first treatment is to surgical remove that thyroid gland. So once the thyroid gland is removed, now they will never feel the Graves disease or hyperthyroidism. But they should have to take some kind of cares, like now there is no T3 and T4 in their body who is responsible for the metabolism. So they should eat with a very conscious mind. Second is the destruction of your thyroid gland. We will give such kind of treatment in which we won't destroy their thyroid gland. So once the thyroid gland is destroyed, now no T3 and T4 is produced. And how we will destroy it? By the radioactive iodine 331. So it is the radioactive method in which the radiations are given to at the patient, and the thyroid gland will destructed out and it will remove. So but this method has very kind of adverse effects, so therefore it is not mostly used. But in the patient it is used. After some times the patient will feel hypothyroidism in them. So now they will start eating the drugs which are used to treat the hypothyroidism, like levothyroxine. The third method to treat them is to inhibit the T3 and T4 synthesis. Now we are not destructing that gland, now we are blocking the synthesis of these hormones. And various two kind of drugs are used for it: propylethiouracil, propylethiouracil, PTU, we can also say it. And the second drug is methimazole, you can say methimazole. So it is mostly used and it has long half life. So I have told to you the drug which have more half life is more beneficial to the patient, because patient will not need to take one or more drug in the daily life. So therefore it has most of the uses, and mostly it is given to that patient. So it can also be given to the patient who have pregnancy induced thyroidism, hyperthyroidism. Now let's discuss their mechanism of action. So it inhibit the condensation and iodination process. So how the T3 and T4 are synthesized. So the process of condensation and iodinization process happens. So if we block these processes, then T4 and T3 will not produce. And once they not produce, now we can save our patient from the hyperthyroidism. Fourth treatment is to block the hormone release. Now the hormones are synthesized but are not released. We will give iodides to that patient to decrease their release. Actually iodides are not beneficial for the long term treatment, because they are beneficial for very short term duration. Their mode of action is remains only for few days. So they have some side effects, like they have very short duration. They can cause the swelling of your tongue, and they can cause production of sores in your mouth and your throat. So therefore it is not mostly used. So actually, it's block the conversion of thyroglobulin into the T3 and T4. So this is the mechanism of their action. Last is the thyroid storm. You know, storm mean a very severe condition, so it means it is a condition in which extreme symptoms are observed. Mean if the patient have high heart rate, so now the extremely high heart rate will observe in a person who have thyroid storm. Now we will give the beta blockers to that patient. What is the beta blocker? You know, they are the hypertension treating diseases, or sorry, drugs. So beta blockers act on the beta 1 or beta 2 receptors which are present in your body. Beta 1 is present in your heart, so by blocking the receptors which are present on the heart, they are decreasing the heart rate, they are decreasing the blood pressure. So the patient who have hyperthyroidism, their blood pressure is so much increased that we should give them beta blockers to them in order to decrease the heart rate or decrease the blood pressure. And then after that we will start the drugs which are used to treat the hyperthyroidism. So the two beta blockers are used for that purpose. Metoprolol and propanol are used. So propanol is a non-selective beta blocker which is used, and it is highly effective and very high half life, because once it's attached, then it never leaves out. So these were all about the today's lecture. I hope that you will like this. If you like it, then please subscribe to this channel, like my videos, and also press the bell icon in order to get the notification of all the video which I uploaded. So thank you so much. Meet you soon in the next lecture or take care of yourself. Allah Hafiz.